Well, today we are discussing a crucial yet often overlooked aspect of our healthcare system, pharmacy services. With the ever-evolving landscape of both retail and specialty pharmacies, understanding their roles and how they can support you and your loved ones, it's more important than ever. We've got Tara Zdiebel and Carmen Doctor. They are retail and specialty pharmacy managers for Trinity Health. Joining us this morning to share some insight, ladies. Thanks so much for being here.
Yeah, thanks
for having us.
Absolutely. So let's talk about some of the services that you offer. I mean, obviously people understand what a pharmacy is, but it's more than that. Let's talk about it.
Okay. Some of the pharmacy services that we offer outside of just dispensing, we're counseling people on their medications, making sure it's correct for them, what side effects they can look out for. Our pharmacies also offer immunizations.
Okay.
You can walk in on a walk-in basis, no prescription required, for several different vaccinations.
That's great. That's great.
Yeah, in addition to that, our pharmacists are routinely counseling on over-the-counter products, helping patients to choose the correct over-the-counter products to help them best manage their symptoms that they're experiencing at home that they may not have to see a physician on.
Yeah, absolutely. And I mean, how important is that consultation with both the prescription and non-prescription drugs? Because I think a lot of people, they'll have all of that paperwork and it probably ends up in the trash most of the time, right? And how important is that face-to-face contact?
Oh, it's absolutely very important. I feel like by law we have to ask if they want to be counseled on their medication, but a lot of patients say no, they don't want to, but then they'll call back later and you know,
right?
What do I expect when I start taking this medication?
And I think another thing with it is so many medications are shifting into the injectable space, and there's such a new technique associated with those, also asthmatic inhalers and things along those lines. The counseling is very important for proper administration of the drug.
Absolutely. And talk about the accessibility and the convenience for patients and how you offer that at your pharmacies.
Sure. We have across West Michigan, we have 13 total pharmacies. We have most of those are retail, but we do have 2 specialty pharmacy locations, one in Grand Rapids and one in Muskegon. And those are really serving kind of more rare chronic disease states. Across our retail pharmacies and specialty, we offer delivery services. Many of our retail pharmacies have drive-through accessibility, also curbside service, and different things along those lines. Ultimate goal is to remove barriers. So how can we help patients get access to their medications?
Absolutely. And let's talk about chronic conditions, people that are on these medications for many, many, many years, and how you can help them with that.
So we
manage
we
their
provide them
conditions,
consultations.
right?
We each pharmacy has a consultation room where we can do a medication therapy management, is what we call it. We look at everything about the disease state, not just the medications, but we can provide lifestyle modifications and other things that can help them with their certain disease states.
Wonderful. Like complementary to their doctor's appointment, really,
Yeah,
right?
Absolutely. And pharmacists are often the most accessible healthcare provider.
Yeah.
And having that convenience of popping into a retail pharmacy or being able to phone and actually speak to the pharmacist is critical.
Absolutely. And let's talk about the specialty pharmacies versus just a traditional pharmacy. What's the difference there?
So specialty pharmacies really work proactively to fill medications that are for more rare disease states. The medications can often be very expensive. And when I say proactively, unlike a typical retail pharmacy, the technicians that work in the specialty space reach out to the patients before they're due for their medication, whereas most patients call in and say, I need a refill on this. That's not even a thing in specialty pharmacy. We call them well before their refill is due to make sure that they don't miss any of their medication.
Absolutely.
And end-to-end in specialty pharmacy services, it starts when the prescription comes to us from the provider's office. We have a team of pharmacy technicians that's working on benefits investigation. How can we make sure that the patients can access the product at a cost that's affordable to them? And I think that's really important. And being able to walk that patient journey with the patient. We also have pharmacists that are trained in the rare chronic disease space locally in Grand Rapids and Muskegon that can help the patient along that journey, help to be a liaison back to their provider offices as another patient advocate for them.
Wonderful. And let's talk about trends too, things that you're seeing in your work, things that you want patients to know about.
Honestly, the biggest trend, specialty pharmacy is going to continue to emerge. Many of the drugs currently in development by drug manufacturers are in the specialty space. So we're going to continue to see this transition. So I think it's important for patients to recognize that additional terminology is going to come. Specialty pharmacy will likely impact many individuals just because it's covering more disease states than it ever has. Another thing that's really trending is delivery services. You know, bringing the medications to the patient. And that's something that Trinity Health has been very proactive with in trying to overcome those barriers for patients. Coupled with that, we're merging retail pharmacy and specialty pharmacy trends to the standpoint that we're now proactively attempting to help our patients stay compliant with their medications through delivery services and trying to, at the end of the day, how do we best take care of our patients to overcome financial barriers, geographic barriers, et cetera.
That's amazing. And is that delivery available to any of your pharmacy patients?
It's available to eligible patients.
Okay.
There is an eligible criteria. However, that's kind of, we'll do it to whoever.
Sure. You get to something to investigate, though.
Yeah,
If this
if
is something
we'll
that you might
investigate it,
need.
and if it's something they need, we'll absolutely do it.
Perfect.
Even if they're not on the eligibility list.
And what do you want your patients to know as they come in, if they're trying to be more proactive, try to take charge of their health care? Obviously, maybe sometimes they're picking up medications and things like that, but what are things that they should bring to you? What would you hope that they come to you with to be more proactive in their health care?
I think they can always come with questions on medications or just general disease state questions. Pharmacists are trained, they're the medication specialists, but there's also a lot of training that goes into kind of some of your more common chronic disease states. And I think just having that open conversation and having an accessible healthcare personnel that you can connect with prior to or to start the investigation before talking with your provider. In addition to that, I think it's very important to keep conversations open on immunizations and various health and wellness components. It's not all about managing an acute symptom or a chronic disease state, but it's more that preventative care too that pharmacists can play a critical role in.
Wonderful. All right, if people want to get a hold of you guys, of your pharmacies, what do they need to know? How do they do that? trinityhealthmi.org/pharmacy. There we go. You want to learn more about all of the pharmacy services, the specialty pharmacies through Trinity Health, you go to that website right there, trinityhealthmi.org/pharmacy. We'll be right back.